So I'm introducing you to my audience here. Say hello.
Hello. Hello.
All right, and I'm going to give you this
Oh, you gonna make me hold it?
camera, yes. All right, so here we go. We're going to have an informative speech here today. The purpose of life is to be happy, but to matter, to be productive, to be useful, to have it make some difference that you lived at all. And that's a quote by Theo Rawson, and that was pulled from Goodreads.com. Okay. So I just want to talk a little bit about what I do. So I am a wound care nurse, technically a wound care specialist. I specialize in wound care. And when you do that kind of job, it's really a gift. You have to know what you're doing. You have to have the knowledge and the expertise and the experience to back that up. Any Joe Blow off the street just can't go and do that job, because if you do, you're going to wind up doing more damage than you're trying to fix. So today we're going to talk about one specific area of wound care that I specialize in, which is pressure injuries. So by breaking down ways to prevent wounds, forms of treatment that we use, other comorbidities that might affect wound healing, and some special situations that could occur to also affect wound healing, such as terminal illness or skin failure. So first we're going to focus on prevention. So one of the main things we're going to focus on is nutrition. So if you have a poor diet, if you don't have enough protein, those kind of things are going to affect your wound healing. Obviously, if your immune system is down, you're not going to heal correctly, because all the nutrients that are supposed to be healing your skin is going to be going to your vital organs, and they're not going to be going to your skin. So you've got to have increase in vitamin C, zinc, multivitamins, and increase in your protein intake to heal wounds, and also to prevent wounds. So another thing we need to talk about is positioning. You don't want to, a lot of these people that are in the hospital or in nursing facilities are just kind of in a state where they're not mobile, so they're kind of laying in one position. And if you don't keep those people rotated, they will wind up with injuries, what we call pressure injuries, in those bony areas, which are you can get them on the heels, the butt area, even on the shoulder blades here. The back of the head. It can be anywhere that a bony place touches, the bed or any other bony place. So legs being crossed. You can get them in like where a trach touches the side of your mouth and they haven't repositioned it appropriately. It can be any of those places. Also, you want to have good hydration and moisturization to your skin. And a lot of times we use, things like this A&D ointment to hydrate the skin, to keep it more flexible, or to keep it from breaking down easier, to bathe regularly, and also to make sure that you're getting enough fluids to hydrate your skin. So once we get past that point and we've said, okay, well, we've done everything we can do, but they're still having an issue, they're still breaking down. So then we're going to talk about how we would stage those pressure injuries. So a stage 1 pressure injury is going to be just redness that doesn't change. Like if you press your finger down and take it away, it's not going to change colors. It's not going to turn from white to red. It's just going to stay that same color. So that'll be called a stage 1. Stage 2 is going to be where you have the top layer of skin gone from the wound, but it's not going to have really any drainage. And if it does, it's only going to have like serous, which is just like a clear drainage, maybe a little bit of pink, but it's not going to have any bleeding. Once you get to a stage 3 wound, that's a little bit more serious. You're going to have maybe into the deeper skin layers. You're going to be dealing with bleeding. You're into the nerve tissue. You're going deeper into the fatty tissue, and you're just deeper in there. And once you're down to a stage 4, you're down into bone, tendon, and those are the deepest wounds that we see. You also, you'll have areas that are unstageable, and that means that you can't see how deep that wound goes. You may have 100%, 100, the whole thing is black, the whole thing is yellow, you just can't see how bad it is, so you're going to call it unstageable. You know it's bad, but you don't know how bad it is. So also, when we treat these wounds, we're going to talk about, if you treat based on symptoms. So if the base of the wound is too wet, you want to dry it up. So you're going to want to use something like an alginate, which is the alginate dressing. You're going to want to use ABD to help dry it up. You're going to want to use foam bandages, stuff like that. So you want to pull the moisture away from the wound. If you want to, if it's too dry, you want to moisten it. So you're going to want to use your hydrogels, your zero forms, your more moist bandages. And then, of course, if you have slough, which is a yellow tissue, it's made of dead skin cells, white blood cells, leukocytes that go to the wound to try to heal it, but they just kind of die out and just sit there, then that is going to be something that you're going to have to get out of there, because it's not going to heal right unless you get that out of the wound. And so you're going to have to debride, and you can debride in several different ways. Of course, you've got debriders that you can do chemical debridement, autolytic debridement, which is like, scrubbing, cleaning, scrubbing, high force water, or wound cleanser. They can also do, some of the alginate dressings will debride. They got medications like Santil, honey. This honey dressing will pull some of that dead tissue out. And then also we do sharp debridement with scalpel. Certain people have to be specialized to do that. So there's just different ways that we can pull that dead stuff out of there. And like I said, if you don't get it out, it's not going to do any good. And so then also we've got specialized treatments. So once you get a clean wound bed and it's just really deep and you need to get it to heal, you may get into something like a wound vac, which is like a foam bandage where you got a suction attached, and it's gonna suck at that wound to get it, get the blood flow coming to the wound, especially if you've got issues where you don't have good blood flow. You want to get that healing better and healing faster. It's going to heal a lot faster with that. Also, some of the debridement things that you'll see in the bigger hospitals, they'll do leech therapy, where they actually use live leeches. They'll use maggots, medical maggots, where they'll put live maggots in the wounds and get that dead tissue, because they will target the dead stuff and not eat the good stuff, and so that's something they will do. So that's just a couple, kind of interesting facts there that they'll do. So that's kind of a lot of information I gave you there. So main thing is, you want your nutrition's got to be in place, your hydration's got to be in place. You got to get the right treatment for the wound, and then make sure that the overall whole person is working right. So as far as comorbidities, which is other illnesses that could affect the wound, if they're diabetic, they're not going to heal appropriately. If their sugars are too high, they're not getting the right amount of sugar in the wound to heal right. If they have COPD or heart issues, which COPD is cardio obstructive pulmonary disorder, that is where you're not getting the right amount of oxygen to your tissues. You're not getting adequate tissue perfusion, which is, like I said, the amount of oxygen to your tissues, so you're not going to heal right then. So that's just a lot of things. Also, end of life, you're not getting the right nutrition that you need, or your body is not absorbing it appropriately, so you wind up with skin failure, or what they'll call a Kennedy's terminal ulcer. And those are a very classic sign. Looks like a butterfly on the sacral area, and then those come on very quickly, and usually you're looking at a couple of weeks, and that's toward the end of life, within the last couple of weeks of life. So that's just some special things that, you just learn those things from experience, what you're looking for. So all in all, let's just, so kind of what we talked about today was prevention. We want to keep them turned, we want to keep them moisturized, we want to keep them hydrated, we want to keep them with good nutrition, right? We want to make sure the whole person is treated, make sure all their body systems are working appropriately, make sure they're just overall checked out with good health. And then we want to make sure we have the right treatment for the wound, or else we're not going to heal right. Make sure the wound bed is clean, have all the dead stuff out of there, and then make sure that we're just doing right by our patients. Basically, that's what we've talked about today. We talked about special treatments, and so that's kind of why I do what I do, because I know a lot of information. I do a lot of education with staff members, family members, and patients on how to take care of themselves and how to take care of their patients. And then also, just basically making sure that we're doing the best we can for our patients, And then, you know, another reason I like to do what I do is because you can actually see your progress. You see that you're making a difference. And so that's, you know, kind of what Mr. Ralston was saying, that, you know, you want to know that you did something to better somebody else's life. And that's the goal of living. So that's it.